Members of the audience, I apologize for our delay, but we had to go into close. In order to comply with Section 2.2, 3712D of the Code of Virginia, it is necessary for the board to certify that since the Fairfax County School Board convened a closed meeting on March 9th, 2020, to the best of each member's knowledge, only public business matters lawfully exempted from open meeting requirements, and only such public business matters as were identified in the motion convening the closed meeting were heard, discussed, or considered by the board during the closed meeting. Do I have a motion? Motion made by Ms. Toland, seconded by Ms. Cohen. All those in favor? And that is unanimous with those present in the room. If I can hold, it's Ms. Toland walked out of the room, but it had Ms. Sizemore Heiser, Ms. McLaughlin, Ms. Cohen, Ms. Pekarsky, Dr. Anderson, Ms. Marin, Ms. Derenak Koufax, Mr. Frisch, Ms. Corbett Sanders. Those opposed, the motion carries. So this morning, we have added something to our agenda to have a discussion and presentation by staff on the work of the staff on addressing thus far addressing the concerns and being proactive in addressing the COVID-19 update. So this is a COVID-19 update. And this part of the session, there will be a briefing presented initially with the leadership of Mr. Smith. And Dr. Brabrand, would you like to provide an intro?
Thank you, Chairman Corbett Sanders. We know the issue of COVID-19 is a serious concern for our community and staff, and we're here to reassure our community and our staff that we are working closely with health authorities to get the latest information and to make decisions on the best interest of our staff and students in our community. We are doing a lot, and we will continue to do a lot to communicate out the work that we're doing, and also this is an opportunity for board members to share with us concerns that I know you are hearing from the community, and we want to be as a staff, and I want to as superintendent. I'm not just a superintendent here in Fairfax County Public Schools, I'm a parent, and I know all of us as parents and educators and people who care about kids have real legitimate concerns that need to be addressed. And our staff is here today to begin to show you what will be the beginning and certainly not the end of our effort to show you what we are doing and what we will continue to do to work to contain and mitigate the COVID-19 impact here in Fairfax County Public Schools. So without further ado, one of the things I have done is appointed our Chief Operating Officer, Marty Smith, to be our point person to lead the COVID-19 effort here in Fairfax County Public Schools. And Mr. Smith will share his team and share some of the work we are doing and be glad to take any board questions.
Dr. Brabrand, before we continue, I do want to get a kind of level set with the board because we are pretty far behind in our schedule, and this was only supposed to go till 11:45. I'm going to take the chair's privilege and move this out a bit, and we'll have to truncate other portions of the day. So if I have the will of the board, I would like to take this conversation until 12:15. Can I get a show of hands if they can support going till 12:15, and we'll work with the rest of the day? Okay, then we've got until 12:15.
Okay.
Mr. Smith.
Thank you very much, and thank you, Dr. Brabrand. Before I begin, I want to publicly thank our community as we are moving through the spread of COVID-19 through Virginia. We know that we've had 2 identified cases. That brings lots of questions, and so we certainly do appreciate the input from our community as we look at how we're mitigate and contain the spread. I'd also like to thank our staff who are working diligently with the health department and in some cases have worked with the Pentagon as we've messaged this to our community and worked through it. And of course, I'd like to thank our staff in our buildings who are on the ground answering questions from our families on a regular basis and who are there supporting our students and staff in our buildings. So again, we'd like to thank everyone for their efforts. This is a very fluid situation. We know that things can change rapidly, and we appreciate everyone's support. Today, I want to talk about our response to COVID-19 here in Northern Virginia. And I do want to provide an overview initially of some of the things that we have done within our schools as the virus has spread. Of course, we regularly update our school and central websites with our COVID-19 communications. We have provided 4 updates to our community and have regularly updated our websites with information from the CDC and the Health Department. We have a 5th communique prepared to go out today explaining information that may have changed from last week. And we are committed to providing those regular updates to our employees and to our community to help them understand where we are as we are facing COVID-19. Hand washing posters and procedures have been distributed to all of our schools to remind our staff of the importance of hand washing throughout the day. We also note that sanitizer has been provided as a secondary, hand sanitizers, but we know that the primary way for us to prevent any spread of any kind of germ or bacteria is to wash our hands with soap and water. With that, our teachers have been instructed to provide time for hand washing and sanitizing, and extra supplies are available for those who might need them. With our cleaning protocols, which include disinfecting all touch surfaces, those cleaning protocols have been reinforced with all of our custodians in our buildings. We feel that we do a very good job of cleaning and disinfecting our buildings on a regular basis. But again, we have reinforced that information with all of our custodians, and it's important to note that our custodians are trained regularly in the practices of cleaning our buildings. Our bus drivers, there have been some questions about our buses, and so our bus drivers are piloting new cleaning procedures for buses, and of course, we're following up to see how those procedures are going. We've provided guidance to schools for talking to children about the virus, and we will continue to provide those supports to our schools as our staff reach out to help explain the virus and the spread of the virus to students so that we don't have, or so that we can create calm amongst our school division. Newly registering or re-enrolling students are providing information to us on international travel. I'll talk a little bit about that as we talk about self-quarantining procedures, but we have provided and will be providing quarantine or travel questionnaires to our families who would be re-enrolling and newly enrolling parents to see if they have gone to any of our countries where the virus has spread that are level 1 and level 2 countries. And we also know that schools are establishing locations away from the clinic for students or staff who may present coronavirus-like symptoms. And again, all of this is on guidance from our local health department. We've had some questions on, we're going to talk a little bit later about possible school closings and what that might look like in Fairfax County. But I know that we've had questions about what parents might do with regard to instruction. Dr. Presidio will be talking about our distance learning opportunities. If there are questions that we have about food distribution, we'll talk a bit about that. And Ms. Lee Burden will be providing some information regarding those issues. And with regard to health care, with child care, we are working closely with the county and actually have a meeting scheduled this Friday with our school-age child care to talk about what options might be for parents with regard to child care options were we to close schools. On the slide behind me, I want to talk a bit about our pandemic influenza plan. We have submitted our pandemic influenza plan to the Health Department for review, and we'll actually be meeting with the Health Department on March 11th to go through and walk through our plan. The objectives of that plan are to limit and delay the spread of a virus pandemic, of course, to minimize those disruptions to operations and how we deliver education to our students, provide stability within the organization and the community, facilitate decision-making during the crisis and how we would approach decision-making, achieve an orderly recovery. As we think about the possibility of closing schools, we want to think about then how we would reopen schools and return to normal operations once the pandemic or the danger was over. And then to, of course, assist our affected employees and their families. And once the plan is finally approved, we will be posting this plan to our public website and sharing it with our school board. I feel it's important to note that many of the decisions that we make around COVID-19 are directed by our health department and our health department officials. We work in very close connection with the health department and work with the superintendent and the school board to make those decisions, but most of those decisions are guided based on recommendations from the health department and the Centers for Disease Control. Within our plan, we want to just give you some highlights of the plan where we talk about specific school closing scenarios. And our plan is based on this notion of two possible scenarios for closing schools. Scenario one is where we would close one school or a small group of schools based on possible contact and to contain the virus and contain the spread of a virus. Again, if we were to close a school, it would be based on guidance from our health department. Our health department would provide that guidance when it is noted that an individual who had been infected or who has been infected with COVID-19 has had direct contact with our schools. We would then work to close that school and provide some disinfecting. I'll talk about that a bit more as we get into the number one scenario. The second scenario is really around what would happen as a system if we would have to close schools in a larger sense, and that would be necessarily to mitigate the spread and transmission of the disease, not necessarily contain, but to react to the spread and transmission. Scenario one looks at those small group closures. Again, these would be based on recommendations from the health department with that contact of an individual infected with COVID-19 being in one of our schools. And based on that recommendation from the health department, that closure could be for 1 day up to 2 days while we would provide deep cleaning within that school. Again, our current cleaning supplies are effective against COVID-19 and are effective at killing COVID-19. And then based on that recommendation from the health department, we would be able to resume school once the school had been cleaned. If the health department recommended a long-term closure, of course, we would implement our distance learning plans for those individuals in those 1 or 2 schools affected, and of course, look at our food distribution protocols. So that's if we're looking at one school or a small group of schools being closed while operations are continuing as usual in Fairfax County for the rest of our students and staff. Scenario 2 is more of a division-wide closure where, of course, we'd have to recognize the complexity of equity issues, distance learning plans, and, of course, food distribution. But this is a situation where the county would make a recommendation to close schools based on the number of students who are unable to go to school based on declining enrollments, or the inability of staff to actually work in our schools based on the spread of the COVID-19 virus. And again, this would be more of a whole district closure that would be directed by the state health department. It could be directed by our local health department, and working in concert with the superintendent and the school board to engage in those division-wide closures. And again, at that time, we would engage our distance learning plans, and would also engage our food distribution protocols that we are working with the state this week, and we actually have a meeting with the state this week to talk about what that food distribution might look like. I'm going to let Dr. Presidio talk about our next slide, which is the distance learning plan. And we have some plans to look at a phased approach to learning for distance learning, as well as thinking about how we might provide options for those students who didn't have access to digital resources.
Thank you very much, Marty, and thank you for this opportunity to get some feedback on this plan, because obviously this is, as Marty said, a very fluid situation that is changing rapidly. And we've actually been working on plans and updating plans for distance learning in the event of a long-term school closure, meaning more than 5 days. So what you see on the slide represents kind of our current best thinking, and we very much are looking forward to getting your feedback and your questions. But it contemplates being prepared for a long-term closure. And the first component of that plan assumes that we would like to have an opportunity to do some professional development and support with teachers so that they would be in a position to be able to resume instruction after a week of closure or more. And we think it's very important that they would have the opportunity to do some planning and preparation, because we have obviously thousands of teachers in the school district. And in my 8 years in the division, when we've done school closures for snow days, we've never had an expectation that instruction would continue. So for many of our teachers in our system, if we were going to ask them to continue instruction in the event of a long-term closure, this would be a new experience for them. And while they've received professional development and technology integration, they've never been asked to actually transition their instruction to an online environment. So that first phase of the plan would call for us to close school, release students from instruction, and work with our faculty members, our teachers, to make sure that they're prepared and receive professional development resources and materials to help them transition to teaching in an online environment. The second phase, which is actually listed as phase 1 there, suggests that if we were closed for up to 5 days, central office, meaning the Instructional Services Department and the Department of Special Services, would populate learning materials online that could be accessed by students and families at home, kindergarten through 12th grade, that would support them in a variety of different subject areas. Most importantly, language arts, math, science, and social studies, and we have a lot of online interactive materials that we think that are engaging and high interest and could be self-directed with students, as well as interdisciplinary materials like projects that students could complete. We have a lot of project-based learning activities. We would love our older students, meaning our middle school and our high school students, to be able to engage during that time with our academic and career plan activities. So we have a lot of really meaningful learning materials that we could populate online during those first 5 days or more if we chose to extend that, which would allow teachers some additional time to start to transition their materials again, to an online learning environment, which is represented on phase 2 here, with the suggestion that after that initial week of closure, the teachers would then resume instruction and provide instruction kind of following the same school calendar. When you think of like high school students on an A-B block, we would follow the same calendar, the same schedule in terms of how we would deliver instruction. We would work with our teachers to try to support them in having opportunities to provide both self-directed, what we would call self-directed or asynchronous learning materials, and hopefully some opportunities for synchronous learning, where students would have an opportunity to have contact with their teachers and with their peers during the day using technology to support the learning environment. Now, we understand there are a lot of equity issues and a lot of questions about, you know, how would we provide support to all of our students, our English language learners, our students with disabilities. Those specialists in the schools would be available to support those students. This obviously would not be optimal. It would not be the same as what a learning experience would look like with teachers in the same environment and students in the same face-to-face physical environment. But if we need to close school for an extended period of time, we do believe that we could provide meaningful learning experiences directed by the schools and directed by the teachers during those extended release days. We also understand that some of our families may have access issues. So I'm going to invite Mary Beth, if she's able to maybe talk about some of the things that we've been planning to prepare for device and connectivity support for our families.
Sure. So one of the things that, as you all know, we've had the MiFis available for families, so we want to remind everybody that we do have those still available if for those families that do not have internet at home and have not yet checked out a MiFi. We also are preparing for elementary and middle to have additional devices available. If the school is closed, we will use devices that are currently used in classrooms and allow them for a checkout process for any of the students that don't have access at home.
And we also want to share that we will be working with VDOE this week as we think about supporting the needs of our special needs students with regard to 504s and IEPs. The other piece that we would consider with regard to school closures and our families is food distribution. And I'll go to our next slide. That currently Food Nutrition Services are consulting with VDOE to discuss those emergency food distribution plans. We'd like to build our food distribution on our current and existing summer meal delivery program. And we would also then design and prepare bagged meals for students and then establish those pickup points within schools with staggered times. And then as individuals and families were coming to pick up those food items, we would ensure that the surfaces would be sanitized and clean as we would, again, allow students and families to come to receive those bagged lunches. While it might not be ideal, again, of course, we understand that we would be looking at this for hopefully short periods of time, but we feel that it's important to provide food for our families while for those who would not have access to food while they're not able to come to school. Our next slide focuses on organizational operation. We have currently developed a core response team. It's the C19 response team, and we're developed to formulate the overall response plan for FCPS. We meet regularly to respond to updates from the health department, to make decisions on division-wide matters, and of course liaise with the school board. We take the issues coming forward as it relates to COVID-19, and we talk about that tiered response. We have level 1, level 2, and level 3 responses. Level 1 responses are, of course, those responses that need to have immediate decision and decision points for short-term information to be shared with our students, staff, and families. Those level 2 responses are pretty much everything else, and we don't have anything that's in a level 3 at this point. So it's really looking at the short term and the longer term, and much of that work is grouped together. We also are in the process of developing work groups that will operationalize specific components of the response plan, and some of the topics that we have identified at this point are related to instruction, student athletics and travel, facilities, including those cleaning protocols, and of course, human resources and HR matters. We've sent information out to the community about self-quarantining procedures, and so I do want to speak a bit about that. For those individuals who are instructed to self-quarantine, and that instruction could come from the federal government, it could come from the local health department. However, an individual has been asked to self-quarantine. For our students, we have procedures in place where our schools will use those current procedures for providing instruction to students that we currently use with students with short-term illnesses. That self-quarantine at this point is a 14-day self-quarantine, so families would be able to receive instruction assignments as they normally would from their school. And our departments are consulting with the Virginia Department of Education to discuss chronic absenteeism. I know in some of the conversations that we've had with VDOE that we would look at chronic absenteeism in schools on a case-by-case basis, and then would look at possible waivers to the state based on what an individual school profile would look like. As it relates to staff, any staff members who would have to self-quarantine would be placed on paid administrative leave during that 14-day quarantine period. And we're talking about those non-temporary staff workers. That includes all of our staff unless those who are hourly temporary. And so when I say non-temporary, our school bus drivers and our parent liaisons, along with our cafeteria staff, are included in that non-temporary. So regardless of your ability to be paid on a daily basis, if you are asked to self-quarantine, you will be provided administrative leave during that time. And teleworking would be available for those individuals in consultation with the principal or program manager. We have many additional concerns, and I'm sure some of that will come up in our discussion this morning, but we do want to share, and we've shared this information with the community, that international field trips have been canceled for the remainder of the school year, and that is based on guidance from the CDC. We've had lots of questions about domestic field trips, and currently domestic field trips are slated to continue as scheduled based on our current guidance. We've had no guidance to curtail or suspend domestic travel. We know that individual states may have states of emergency, and they have those states of emergencies for a variety of reasons. But we currently have no guidance from the CDC to curtail or suspend, and we'll be following that guidance. As always, parents may choose to withdraw their students or from that travel at any time, but we are not suspending. School-wide events are slated to continue as scheduled. Again, we've received no guidance from the CDC to curtail public gatherings. We've had many questions about international nights, concerts, athletic events, and again, we have no plans at this time outside of guidance from the CDC. It's important for communications that we would keep the board and the community up to date, because that is essential. We'll be providing those weekly updates to the community and the staff, and of course to the board, and developing those ad hoc communications as situations arise outside of that weekly cycle. And again, we found ourselves in that situation as we found the first case identified in Fairfax County, where we had to pull together some ad hoc communications that fell outside of our regular plan and actually occurred on a Friday evening. And last, I want to share with you our resources. Our FCPS homepage has been updated. You'll note if you go to our FCPS website, we have our emergency notation stated there, and it will direct people, if they have questions about COVID-19, it will directly link them to the COVID-19 website. Linked to this presentation are all of our health department updates as well. As I shared earlier, the 5th communication about COVID-19 and our response will be going out to community and staff this afternoon. Again, we look forward to a robust discussion. I do want to share one thing that's come our way, and again, this is all very fluid, and I need to thank staff for working through the night to prepare our presentation and prepare materials for today. But there have been questions about how we're working with students and staff and their possible mental health issues that might be related to COVID-19. And of course, with staff, we will be providing information to direct those staff to take advantage of our EAP resources. And as we shared earlier in the presentation, we're working with our counseling staff to provide information to schools on how to talk to children about COVID-19, and we'll be providing those same updates for parents. And so I do want to address that, because we've heard some concerns. We didn't have enough time to pull that into the presentation. And with that, we're open to questions.